Theranatal is a medication that is a combination of multivitamins and iron. It is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and help to maintain good health. Taking Theranatal can help ensure that you are getting the necessary nutrients for your body, especially during pregnancy. The recommended daily dosage and optimal timing for taking Theranatal may vary depending on your specific needs, so it's important to consult with your healthcare provider for personalized guidance. When taking Theranatal, it is best to take it by mouth, usually once daily or as directed by your doctor. It is important to follow all directions on the product package and not to take more than the recommended dosage. It is best to take Theranatal on an empty stomach, 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take it with food, but avoid taking it with antacids, dairy products, tea, or coffee within 2 hours before or after taking the medication, as they may decrease its effectiveness. It is also important not to lie down for at least 10 minutes after taking the tablets or capsules. If you are taking the delayed-release form or extended-release capsules, it is important to swallow them whole and not to crush or chew them, unless directed by your doctor or pharmacist. Taking Theranatal regularly at the same time each day will help you to get the most benefit from it. If you experience constipation, diarrhea, or an upset stomach, these effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, contact your doctor or pharmacist. Iron in this medication may cause your stools to turn black, but this is not harmful. Your doctor has determined that the benefits of this medication outweigh the potential side effects. Many people using this medication do not experience serious side effects. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of potential side effects, so contact your doctor or pharmacist if you notice any other effects not listed here. If you're in the US, call your doctor for medical advice about side effects. You can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you're in Canada, call your doctor for medical advice about side effects, and report them to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. Always follow the dosage recommended by your healthcare provider. Take Theranatal once daily with a meal or as directed by your doctor. This medication is used to treat or prevent low iron levels in the body. Iron is an important mineral that the body needs to produce red blood cells and keep you in good health. Before taking Theranatal, make sure to inform your doctor or pharmacist about any allergies to its ingredients or any other allergies you may have. This product may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist for more details. It's also important to let your doctor or pharmacist know about your medical history, especially if you have iron overload disorder, a history of alcohol use or abuse, liver problems, or stomach/intestinal problems. If your multivitamin brand contains folic acid, be sure to inform your doctor or pharmacist if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency, so it's important to consult your doctor or pharmacist for details. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, make sure to inform your doctor before using this medication, as it may have an impact on pregnancy. Additionally, if you are breastfeeding, consult your doctor before using this medication, as it passes into breast milk. The use of Theranatal may interact with other medications you are taking, changing how they work or increasing your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Theranatal may decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate your doses of these medications as much as possible from your doses of Theranatal. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your brand of multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Theranatal may also interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone has taken too much Theranatal and is experiencing severe symptoms like passing out or difficulty breathing, it is important to call for emergency help right away. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, residents can call their provincial Poison Control Center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to seek help immediately if you suspect an overdose. If your doctor has prescribed Theranatal, do not share it with others. It's important to keep all medical and lab appointments. Some brands of Theranatal may also contain ingredients such as docusate. Ask your doctor or pharmacist if you have questions about the ingredients in your brand. It's important to remember that Theranatal is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods. Maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. Also, make sure to take Theranatal at the recommended daily dosage and at the optimal timing as directed by your doctor. If you forget to take your prescribed dose of Theranatal, take it as soon as you remember. If it's close to your next dose, skip the missed one and take the next dose at the regular time. Do not take double the dose to make up for the missed one. It is important to take Theranatal as directed by your healthcare provider for the best results. It's important to store Theranatal at room temperature, away from light and moisture, but not in the bathroom. Make sure to keep it out of reach of children and pets. When you no longer need it or it's expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.